Hi everyone, my name is Shira Newman and I am a registered dental hygienist currently practicing in Dallas, Texas, and I'm incredibly passionate about biological dentistry and practicing holistically, and I hope you will be too. So when you hear that, biological dentistry, what do you think of? What do you think that means? Biological dentistry is basically emphasizing that your mouth can be the cause of systemic disease, and systemic disease can have a massive effect on your mouth. It goes both ways. So it's us as dental providers trying to get to that root cause to see what's going on, looking at a number of factors, really kind of piecing a puzzle together. So from a hygiene perspective, let's just start at the beginning. Scaling is no longer the standard of care that should be practiced because you are not dealing with your mouth on a bacterial level. You're just scraping away only to leave behind the bacteria to just keep doing the same thing, wreaking havoc on the mouth and the body. Gracies, the scalers, were invented in 1945, and ultrasonic was invented in 1950. It's 2020 and we're still using the same practices from 70 years ago to treat our patients when we could be doing that and more. We know that those methods work in removing plaque and calculus, but we're not healing the gums on a bacterial level when we could be. And so that brings me to ozone. What is ozone? Ozone is 3 oxygen molecules bonded together to kind of create this super oxygen molecule. And it's super beneficial in healing. In bacteria, the super oxygen molecule is so powerful, think of it as an arrow that just kind of goes right through the bacteria and kills them instantly before they can even think about responding. With viruses, not created to withstand oxidation. So this high level of oxygen coming their way alters their cell membrane so they're unable to attach to another cell and replicate. For infection, you don't realize this, but your own immune system uses ozone to help fight infection because it needs that high-powered oxygen just for the immune cells to be able to work at their best. And what's crazy is studies have been shown, like the slide coming up, that within 1 second of ozone application to a tooth covered in biofilm, 99% of bacteria are killed. That is huge. So now my question is, why isn't everyone in hygiene using this to help treat our patients better? I personally started using ozone and it has been a game changer in getting my patients stable. I use it in all of my water, all of the lines, and right when my patient sits in the chair after we've gone over the medical history, done blood pressure and vitals, chatted a little bit about their brushing routine, I explained the merits of ozone to them and about the ozone gas treatment that they're about to receive and how it's going to basically be a mouth reset for them, and that this is when their home care becomes the most important. We're partners in health. I am now giving them the tools to move forward in a healthier way. It's now their turn to go out and actually do their homework. So this allows me to kind of practice everything that I've been preaching for years, that you need to be able to kill off everything. You need to be able to repopulate the mouth with healthy bacteria, good home care. This makes a cleaning. Ozone makes a dental cleaning, an actual cleaning, because you're getting the bad bacteria out of the equation. And that's what we need. Could you imagine a periodontal patient coming in to see you who's been active perio, unable to get stable for years upon years, and now at every 3-month recall appointment, you're doing an ozone gas treatment, you're using ozone water? Let me tell you, it's a game changer. It's a game changer because you're slowly lowering all of those bacterial levels. So this needs to become a standard of care, in my opinion, but I think that hygienists need to advocate for it themselves. You should want to be able to provide this level of treatment to your patients. The days of scraping solely, they're done. They're done. We know too much now. We know that it's not getting everything on a bacterial level. We've been handed this gift of ozone, and now we're able to kind of change the game and be like, okay, you know what? I'm able to actually help you be a healthier you now. So, all in all, ozone is wonderful in the dental setting and has so many other uses outside of dental hygiene. You know, I can't speak highly of it enough. And the second that you start using it, you're gonna see a massive change in how your patients' mouths look and how they feel. So definitely start the conversation with the dentist that you're working with on incorporating ozone into your hygiene regimen. Your patients will thank you. We as hygienists are here to make sure that we are on the front lines helping our patients be the healthiest version of themselves, and this is where it starts. Thanks so much for listening.